Hi, thanks for coming to Park Avenue LASEK. I wanted to talk to you because one of my fellows, that's a junior doctor, they're MD PhDs, they are surgeons in their country, and they did look at you and confirm that you're a good candidate. They're supposed to high-five you so that you're clear that you're a good candidate. So you wouldn't be watching this video if we couldn't help you because there would be no purpose to it. That means that you decided for some reason not to proceed. Now it is understandable, it's a big decision, it's one of the more important decisions in your life because it does affect your vision for the rest of your life. So you want to make a good choice about where to do it, who to let you operate in your eyes, and I guess if to do it or not. In terms of safety, I want you to be clear that the non-cutting LASEK procedure that I helped invent at Harvard about 20 years ago is actually safer in the long term than contact lens wear. Most people are saying, I don't know if I want to do this because I think it might be not that safe and I don't want to risk safety in terms of enjoyment of freedom without glasses or contacts. While that does make sense, I think that means those people are comparing laser with nothing, and the vast majority of our patients, probably you, are wearing contacts most of the time. So we have done many studies, and you can look this up if you don't believe me, that long-term contact lens use is actually more dangerous for vision loss than the non-cutting laser vision correction that we're specializing in as Park Avenue LASEK. The reason is everybody kind of misuses their contacts a little bit. Many patients wear them too long to try to save money, so instead of replacing them every month or whatever, they might try to go 2 or 3 months to save money. Very few patients clean them properly, so they take them out, they might throw them in the solution, not clean them or not empty the solution, again trying to save money or being lazy. About 10 years ago, there were like 300 patients who went blind from contact lens solution. It was by a Renew one-step solution, and it was shown not to be cleaning the contacts thoroughly enough, and some fungus stayed on the lenses, and these patients unfortunately went blind. So you have to understand that contact lens use is not risk-free. And from a just normal thinking point of view, you got to understand that putting a piece of plastic in your eye and having it there for 12 hours every day and taking it out is just not really risk-free. And a lot of the people who come here actually come here because they had an infection or an ulcer or a scar or abrasion, or they have some contact lens problem, and that's their reason for coming in. Because I do understand if you have no problems whatsoever, maybe your motivation to get lasered is a little bit less. So the first point I just wanted to sink home is that the non-cutting laser is safer in the long term than continuing contacts. So you just have to understand this and believe this statistically. And again, you can do some research, you don't have to believe me. The second thing is financial. It's a similar argument, by the way. In other words, patients think that they can't afford to get lasered. They're wrong, because every patient is spending thousands of dollars every year, every 2 years, on glasses, contacts, and solutions. So we've again done studies that show that the average patient between glasses, contacts, frames, solutions, eye exams, they're paying about $1,000 a year. Okay, so that means in 5,000 years, in 5 years, they're wasting $5,000, and that's the same price as getting lasered. So people want to be financially responsible, and they want to save up for their laser, but that's actually not financially responsible. Now I do understand it's counterintuitive, so that's why I'm going to explain, okay? So let's say you come to me in 2010 and you save up for 5 years, and then you get lasered and it costs you $5,000. Well, that means from 2010 to 2015 you wasted $5,000 in glasses, contacts, and solutions, and then you got lasered and now your total spend is $10,000. If you just did it in 2010, your total spend would have been $5,000, and you wouldn't have flushed the additional $5,000 on glasses, contacts, and solutions. So that makes sense to you, right? And then people are like, oh, well, I don't know if I can afford to pay $5,000 right now. Well, we do have financing. In other words, if your credit score is above 600, we can finance the whole amount, and you only have to pay the same as you're spending on glasses, contacts, and solutions, maybe at most $1 more per day, which is $30 more per month, okay? Anybody can afford another $1 a day. I mean, it's crazy. $1 more than you spend in Starbucks. Starbucks could be $10. So we're always saying if you could skip 1 to 2 Starbucks a week, you could pay for your laser. So again, the whole affordability thing is clearly a miscalculation by most of the patients. They think they're saving and being prudent by saving up, and they're actually being more prudent by just taking on a loan, paying off the loan, and then they just pay for their laser. They don't pay for the laser and the contacts and glasses and solutions for 5 or 10 years. In terms of the total spend, we're the only center in New York City that accepts medical insurance, and the reason is I'm pretty much the only laser surgeon, a full-time laser vision correction surgeon who's also knows how to do corneal transplants. I got trained. I stopped doing transplants about 20 years ago to focus on laser vision correction, but I was trained in corneal transplantation. It's part of a corneal refractive surgery fellowship, which I did, and you have to be able to do transplants if you want to treat really bad corneal disease. So you can't send a bill to the patient for $50,000 for a transplant. They're not going to pay the bill. They can't pay it. So you have to bill their medical insurance. So I'm credentialed with every major medical insurance company in the country. So if you have any type of decent medical insurance, let's say you're not ready to get laser now, either for psychological reasons or financial reasons, what you really should do is just convert your eye care from your local eye doctor, either ophthalmologist or optometrist. Optometrists do glasses or contacts. They take vision insurance. Ophthalmologists went to medical school. They could do surgery. They take medical insurance. We're ophthalmologists here. So we would just take your medical insurance every year, and then you can come here for glasses or contacts. You can come for 5 years. You can come for 10 years. I don't really care. So let's say you weren't ready, and again, you converted to coming here for your glasses, contacts, that kind of thing for 5 years. Each year, your medical insurance, depending how good it is going to pay us something between $200 and $600 for the visit. Average is maybe something like $300, okay? So let's say that you came here for 5 years and they pay us $300 every time. It's $1,500 that they paid us, and we're actually crediting that towards your laser. So if you decide in 5 years to do it and you were coming here every year, instead of paying $5,000, we subtract the $1,500, you only pay $3,500. So even if you're thinking of maybe doing it down the line, I really think that you should take advantage of this unique offer, the only one in New York City, because the other people don't take medical insurance. They're not going to be able to make you this offer. Just convert your care to us. We'll do your glasses or contacts. Clearly, it's a lot simpler to do glasses and contacts and annual eye exam than it is to do laser vision correction surgery. So that's really easy for us. And then you don't have to worry about, do I have vision insurance? Because we don't take vision insurance. That's for optometrists to pay for glasses or contacts. We take medical insurance. So as long as you have a decent medical plan with a low deductible, it's fine. You just convert here, and after a few years, you decide to do it. You save thousands of dollars. If you don't convert, it's fine. Just stay in your glasses or contacts, and that's fine too. So I think I took care of the financial aspect. I think I took care of the safety aspect. And I do want to reiterate that I wouldn't be talking to you now if you weren't a good candidate. If you're not sure, just ask the doctor who examined you, one of my junior associates, and they'll be more clear with you. And most of them are English as a second language, so they're surgeons in their own countries. Many of them are MD PhDs, but maybe their English isn't perfect, so just ask them again. And you could ask them, like, if I were your brother or sister, what would you recommend and why? And they'll tell you. They're very honest. They don't have anybody working here who's not ethical, and they'll just tell you the truth. The final thing I wanted to say is you should take advantage of coming back. Maybe you came to see me, right? I am kind of well known. I don't really think you came here to see my fellow. If you were scheduled to come in when I'm not here, the staff should have told you that and given you the option to reschedule. If they didn't, I do apologize. But all is not lost. You can come back and see me, and it's actually maybe better because you have the candidacy thing. You talk about it with your wife or husband or whatever. You think about it more, do some research, watch this video, and then you come back to me armed with more questions. Maybe you're shopping around, you want to go to other centers, it's fine. We do like it if you come back. You should ask the staff for, like, we have a little spreadsheet to fill out for shopping. Basically, we gave you the metrics that I think are important. It's very hard for a layperson to really figure out what metrics are important, so I just kind of did this for you. So just go around, you fill out your little spreadsheet, you come back. There's no cost to that second visit, and then I'll talk to you about the pluses or minuses. To be honest, there are many other good surgeons in New York City who do LASIK. There are a couple that are bad. There's one who has 100 lawsuits. You might not be able to figure this one out. You can go on New York State, New Jersey State websites and look up the number of lawsuits and losses. I have none, but I don't know, it might be hard for you to figure these things out, okay? Different brands of lasers, bladeless. Some of them are going to say it's bladeless. Bladeless is basically cutting the flap with a laser. So basically, just take advantage of coming back, and I'm happy to talk to you. There's no cost for that. So again, I thank you for coming in, and hopefully you'll come back and talk to me, and we'll discuss this further. Thank you.